It's great to have you along. Thanks so much. Well, look, without further ado, this is the meeting of the Children and Young People's Special Interest Group. We are recording it because we always get quite a good turnout on catch up when people are able to view this at their own time outside of their working hours. So I'm delighted to be able to welcome today Rebecca Thomson, who's partner manager at MeeToo Education. And Rebecca's going to talk to us about how digital peer support is transforming mental health services and outcomes for children and young people. Rebecca, this is fantastic. It's just lovely to have you with us. I think, are you and I doing this as a sort of facilitated conversation? Is that the idea?
Yeah, I mean, if it's just you here, so what I was going to do was just give you a little bit of background into who we are, what we do, then give a little demonstration of the app, and then talk a little bit more about the work that we've done within schools and local authorities and some of the outcomes that we're achieving.
That's super.
That's all right.
Just before you get to that, can you give us an idea of the scope and scale of the sector that you're addressing? So it's children and young people, you're looking at mental health services specifically. Have you got any kind of feel for how many children and young people are currently trying to access mental health services?
Well, where we sit is that we are aiming to get to the young people before they reach that stage. So we're all about early intervention and prevention. So the mental health app that we've got is aimed at children aged 11 to 25, with the idea that if you get to them, well, research shows that the earlier you get to them before they reach crisis point, the recovery is better, but secondly, you're stopping situations escalating and therefore, reducing the demand that's on tier 3 services. I have no idea what the waiting lists are.
Okay, well, maybe somebody else in the audience can give us a figure, because I've this terrible feeling that whatever is announced, the true figure is probably double or even triple that. I've got no scientific basis for that whatsoever, can I just stress, first of all.
Put it this way, at any local authority or CCG that I've spoken to, there aren't any yet that don't have waiting lists. So
absolutely,
yeah.
Okay, so could you just tell us, just to frame this, first of all, you've got your app that you've developed. Is this who pays for this? Is this the integrated care systems, local authority, trust, primary care? How is it? Who pays for this? Is it prescribable?
So there are two aspects. There are two services that we provide. So one is the app, which is our core sort of flagship service, and that is actually free because we're a social enterprise and our mission is to support as many young people as we can. So our infrastructure is that the app is free and will always be free. In order to ensure that, we have developed a service to sit alongside the app, which is a paid for service, so subscription, the minimum of 12 months. And to sit alongside the app, we actually create an engagement program. So we work with schools individually, or we can work with local authorities to create a program of engagement which enables us to go out and talk to young people, talk to schools, talk to teachers, to introduce the concept of digital health support.
Sorry, just to be really clear,
yeah.
Who pays for it?
So in that instance, there's two options. So the app is free. That is it. End
of.
I
understand that. I'm talking about the subscriber bit.
So if the subscription, so schools can pay for that directly, or local authorities or right. CCGs.
Okay. So I just wanted to make it clear to our audience, we're not asking children, young people and their families to pay for this. This is provided by schools and local authorities and trusts.
That's right.
Jolly good. Okay. Well, look, why don't you tell us a little bit about the MeeToo organization? It's a social enterprise, as you've just pointed out. When did it start, Rebecca? When did you get going with it?
It was launched in 2015 by our CEOs, who are Susie Godson, who is a research psychologist. She also happens to be a journalist for the Times, is the sex and relationship columnist, and Shuston Cumley, who is an educational technologist. And they met back in 2015. Susie used to work for Childline and saw that there was a real need. Demand was outstripping supply even back then, and phone calls were going unanswered, and it troubled her. She thought, gosh, where do these young people go who've plucked up the courage to call for support, and then their call is going unanswered. So originally it was designed as a web-based solution, and then we took it into 3 different schools in London, and immediately they said to us, we're not interested in web-based tools. We're digital natives. We like apps. So it was very quickly changed, and the app was actually launched in 2017. It's really important.
Tell us a little bit about the app then. Tell us a little bit about why it's different. What does it do? Why is it, particularly interesting, how do you make it appealing to children and young people in that 11 to 25 kind of age? Because there's a lot of diverse, from 11 to 25 is a huge difference, isn't there?
Yeah.
In terms of
okay. Yeah, no problem. The app, our sort of USP, if you like, is the fact that, well, there are 2 things. One is that it's based on peer support. And I'm sure your audience understands that, peer support enables young people who share similar life experiences to provide each other with reciprocal support, advice, empathy, validation, and a sense of belonging, which adults, so parents, teachers, professionals, who've not endured the same difficult situations are often unable to provide. So that is a really important differentiator. The second really, really important aspect is that every single post and response that's put on the app is pre-moderated. Now, what I mean by that is that we have a team of moderators. So just like Childline have people who are answering calls, and Shout have people taking text messages, we have a team of trained moderators who look at all these posts before they go live. And they're checking for risk, most importantly, but secondly, checking for, humiliation, judgment, bullying, or anything like that. Because what's really important is that this is a really, really safe and supportive platform.
Okay, can I just pause you for a moment there? So if a school wants to access this service, or a local authority perhaps wants to pay for it for a group of organizations within its purview, does it then just encourage the young people, the children and young people, to download the app and get on it? They promote it, presumably. I'm just wondering about the sort of the scale of use that you've got of it, basically. So if you are making it available to a typical high school, for example, or comprehensive school, do you have any feel for the sort of percentage of young people that would typically download it and be looking to access it?
Yeah, we do. So when we engage with schools, so our sort of average immediate uptake would be about 5% of that school population. We work hard to increase that. That is the objective of our engagement with the pupils, and we track that quite avidly. And the way we do that is through something called a portal within the app. So there's an extra that we create, which is part of this paid service, that young people can click onto, so they connect to their school, and within that little portal, so it's like an information hub, there's information about the school counsellor or services or anything that's related to mental health and well-being. But in so doing, that allows us to track how many pupils within that school have connected to the portal. Now, some people say, but kids might not want to do that because it's associated with the school, although it is 100% anonymous, the app. We don't have our users' names. We've only got email addresses. There is part of the engagement is this educating process to gain the trust of the young people. And we find that a lot of them do go on the app, and we call them sort of, they look at it, they don't necessarily post, and then once they've seen the context and the support and the way it works, they will then access the portal because we've gained the trust.
All right. Well, look, let's push this along. You're going to give us a little demo, is that correct?
Yeah, sure. Yeah.
We'd love to see it. Let's just. I'm going to leave this to you entirely, Rebecca.
Okay, that's fine.
Show us. You take us through this, how the functionality works and how the interaction works. Thank you. We've got you. We can see that perfectly well. Thank you.
Okay, wait a minute. Sorry. Let me just get into MeeToo. So here we go. So this is the app, and as I said, it is anonymous, which is really important for young people, because a lot of the reason that young people don't start conversations or talk about how they're feeling is that they don't trust the environment they're in. So you'll see here that it's a rather unusual name of Wet Evil Penguin. And the reason we make them slightly long and slightly obscure is that we don't want them to be copied across other sort of devices or platforms. So it's really for a cybersecurity reason. We also try and make them fairly gender neutral. Again, what we're trying to do is create as sort of neutral a space as possible. It looks very much like a sort of Instagram or Twitter feed, but actually,
can I just, sorry to interrupt you. Is this the sort of page they get as soon as they go on it?
Yeah. So this post that you see will have. So this was posted, it says 5 hours ago. So before this was posted, our team of moderators would have looked at it. So they work in shifts, and they check the back end of the app every 20 minutes. So they will have had a look at this post. They will check for the level of risk, i.e., what is the, what state is this user in? If it reaches a threshold 4 or 5, which are our two highest levels.
Yeah, sorry to interrupt you. Sorry to cut you off. I'm just interested. What does the home page of the app look like, basically?
Yeah, this is it. Yeah.
So literally, that's the first thing anybody sees.
If that's when they go into the app, if that's what they've clicked onto, there is also a directory. So if the last thing I'd been on within the app was a directory, that would be the first. Okay, that would be the first.
And just before you move on, we've got Joe who's raised his hand. Joe, do you want to ask a question?
Absolutely. And you may probably get onto that, but it's just there in my mind right now. Obviously, you said that you don't take, obviously it's all anonymized. What happens if there's a safeguarding concern through this or from a discussion that happens in terms of just having their email address? What do you do in those instances?
Yeah, so we're here to obviously support, and when you say safeguarding, if there's anything that is of a criminal nature, obviously we will not put that post live, and we will escalate that to other services. If you're also talking about, what do we do about posts if we feel that, someone is, so perhaps there is a potential risk to life. We have trained counsellors on the app, and all these level 4 and level 5 posts, we will, as I say, quarantine, so they will not be live on this feed that you're seeing here. They will be forwarded to our counsellors, who will have a look at the posts and will contact the users direct.
So they'll do, I think what Joe is asking is, how do your counsellors contact the users? They just do it by email, presumably.
Yes, so we're doing it via the app, or we have their email address. Yes.
Oh, I see. You can do it by the app as well.
Yes, so that would be our normal mode of the counsellor's mode of contact. So there's a DM, there'll be a DM system or through email, whichever is the easiest route.
And Janaba asks, what's the name of the app?
Oh, the app is MeeToo, MEETOO.
There you go, Janaba. I hope that's clear. Okay, sorry to keep holding you up here, Rebecca, but it's just, best to ask questions as they occur. There we are. Keep going.
Sure. So in the situation where we we don't break confidentiality. So our agreement is with the young person. It's not with the school. It's not with the local authority. But if we have seen that there is a safeguarding concern of a legal level, or if there is an individual where we have had to call emergency services to get involved, we will let our partner school or local authority know about it. So our sort of what we're out to do is to make sure that these young people get the most appropriate support possible. So going back to the feed here, so this one that we're looking at here, Wet Evil Penguin, they're talking about they can't go to school because they keep getting panic attacks. I just need someone to smile at me and ask if I'm okay. So I said at the beginning that the app covers age 11 to 25. It's also age banded. So you see 2 years above or 2 years below your age. I'm signed on as a 17-year-old, and there's no concern that although I'm 50, I'm signed in as a 17-year-old, because every single post is monitored. Therefore, if I was trying to do anything adverse on the app, it wouldn't be allowed to get through, because our moderators are checking every single post. So this individual here, you can see a little love heart and a number 5 next to it. That means that that post has had 5 likes. And then if we look at the arrow and a 1, that means that they've had a response. On average, oh, sorry, my things.
It's okay.
I don't know why that's not showing the response, but on average, let's see if I can find another one. Sorry, technology is great when it works. There you are. I can't see it because you're. So don't worry, you're not alone. I feel the same. Just try your hardest to find someone to talk to. You can talk here if you want. So on average, every post gets 3 responses, and we very much encourage our users to reply to each other, because it's evidence that one of the best ways of helping yourself is to help other people. We do also have a group of undergraduate psychologists who work on the app, and they look like any other user, but they're actually what we call our super peers, and they are there to give model answers to issues and concerns. With their psychology background, they're able to maybe suggest sort of solutions that younger users might not have thought of. It's very much an education tool as well. So throughout the app here, so the mainstream, so for instance here about confidentiality, we're saying that you can talk about anything that's worrying you, and we won't tell anyone, not your school, university, your parents, your employer, or the government, what you say. MeToo is private, unless we are worried that you might be at serious risk of harm. But we also have articles like clean sleeping here. So if you click on that, that gives you some advice as to how to get sort of the best night's sleep. We also have things on sort of self-harm, sex education survey we've been doing recently. Sorry. So the point of me showing that to you is that basically it's not just, sorry, my phone. Oh dear. It's going slow. It's not just a tool for people to share how they're experiencing. It's also about the fact that we are trying to educate them. Sorry.
It's okay. Relax. Just while you're doing this, I've just looked it up on Google. NHS Digital Monthly Mental Health Stats. Over 340,000 children and young people were in contact with children and young people's mental health services in July 2021, so pretty much a year ago from now, meaning that, and that means they were waiting to commence treatment or currently receiving treatment. That's the highest number ever recorded. Now, clearly they're people who are not they're the people who are at the stage of trying to access formal NHS mental health services. What Rebecca is talking about here is people that are not at that stage, but still would find something like this beneficial, I guess. I guess what you're trying to do, Rebecca, is sort of head them off at the pass, for want of a better word.
Yeah, absolutely. Yeah, so I mean, there's several aspects of what we're trying to do. One is we're trying to enable young people to talk about their feelings, to understand that they're not the only person out there that's going through these things. I mean, we see time and time again people posting, "I am a freak." And, you know, by doing that within this supportive environment, they understand that actually, no, you're not. You know, we've got 60,000 young people who are signed up to this app. On average, we have about 6,000 users that are live. And they learn very quickly that they're not a freak, that adolescence, that growing up is a really difficult and confusing time. So sorry, I've got back onto the main feed. I just want to show you the directory as well. So that gives you an idea of the feed and what young people are talking about. If I hit on the icon here, which has got a little book at the bottom of it, we know also that one of the problems around, you know, dissipating or de-escalating issues is that young people don't know where to go to get support. And, you know, they may see it on a poster at school, or they may have read about it on a website, but in the moment of crisis, they forget where to go. So we've created this really robust directory of resources, which we have a team who check to make sure that they are, you know, hit thresholds, and we store all that information here. So you can see the first area is called Get It Off Your Chest, Talk to a Professional Now. So there's all sorts of charities and services that they can access here. We also have apps, TED Talks, podcasts. Then we've got this other area, helping others. And then the one here, Get Published, is one of the most popular areas, and it's kind of real life stories about people and what they've gone through. And a lot of our users actually contribute to that. And our only caveat when they write to us and say, you know, we want to share a story, is that there's an element of hope to it. You may also see that at the top here, it says add tags to refine your feed and directory. So obviously we have a lot of users who may feel triggered by certain topics that are being talked about, and we want to make sure that that doesn't happen. So in fact, sorry, if I just go back to the main feed, they have an option now to a sensitivity setting, so to choose the level of sort of severity of the post. So I've selected moderate, but say you were, you know, really sensitive and really quite vulnerable, you could just say you wanted to see mild posts. That would maybe be people talking about, you know, friendships or the fact that they've stubbed their toe or whatever. And then you can go up to the highest, which would be everything. And then the section below, which says hide topics you don't want to see. So those are obviously topics that, you know, you maybe don't want to read about. You may be in recovery for something. Therefore, you would tick the particular topic that you don't want to see. Therefore, it would not appear in your feed. And then going back to the directory, sorry, just moving your image. That tag at the top enables you to choose topics that you might want to get resources on specifically. So say you are autistic and you wanted to get some information specific to that, you'll see that this has changed and has brought up some different resources. So that's a very quick whistle-stop tour of the app. As I mentioned, you know, and you kindly asked, the app is free, but we also have this paid-for service, which involves engagement, but also involves us giving data insights back to schools or to the local authority, depending on who's sort of paid for the service. And I just wanted to show you some of those data insights that we can share. So this is a report that we have given to one of our partner schools, and what we do is we can break down the age of the users at the school. And again, this is going back to the fact that it's gone through the portal. So this particular school, we can see that 13% of the users are aged 11 to 13, 57% of the users were aged 14 to 16, which is generally our sort of largest cohort. 17 to 18, there was 18%, and there was obviously a couple of 19-year-olds at that particular school. We can split it with gender. We have 40% of our users are boys, which is a really, really high user rate, which we've worked really hard to achieve. Something that we're very interested in is male mental health. This risk level refers to the sort of level of posts I was talking about. So 1 being mild, 5 being urgent. So again, you can see that most of the posts are sort of mild to moderate. And then we go into trends as to what the young people are talking about, which is what schools and local authorities find really, really interesting. So this school, for instance, term 1, they were talking, the most talked about topic was depression, then it was friends, then it was self-esteem. Whereas the following term, it was friends, emotions, and relationships. And we can then compare that against the national trends. So that's all the other users on the app. So in this situation, it can help schools and local authorities understand, you know, where are we doing well, and what areas are our young people struggling in at a higher percentage than the national average. You know, what support do we need to put in to try and rectify this disparity? And then we actually go into specific posts. So for instance, we went into this post where a user is talking about, you know, bottling things up and how they find it difficult to talk about emotions. And at the end of this, we give the schools sort of resources that they could use in order to maybe support PSHE lessons or tutorials to help the young people talk about these different things.
All right, thank you, Rebecca. Has anybody got any further questions for Rebecca at this stage? Yeah, Adam, you go ahead.
Struggling to unmute myself then. Hi, sorry. No, I mean, first off, I think it's incredible. I think, you know, I think it's wonderful that there's things like this that exist now for children and for young adults. I know when I was younger, stuff like this would have been just so useful for so many of my friends and myself. So I think kudos to that. I think really mine's just around the safeguarding aspect, and you may have answered it, but I must apologize, I'm multitasking. When you were saying you were obviously of a different age on the app, but logged in as a 17-year-old, just the safeguarding aspect around the whole grooming side of things. I know you said potentially that they're being monitored, but there's no risk of people gaining contact information from each other underhand, is there?
No, so that's the other thing, that's the other job that the moderators do. So, and it's not just personal information that's an issue. Actually, with eating disorders and other areas, we need to be really careful that people aren't sharing, you know, any information that could be detrimental to, you know, anybody's well-being, whether that's, as you say, an address or personal details, or as I say, it could be, you know, things particularly around eating disorders. They're quite clever. So we will not let any of those sorts of things through. And it's really important, you know, there are a lot of apps out there that say they are pre-moderated, and I've yet to find one that is 100% pre-moderated. And what I mean by that is that, you know, we don't let anything through until we've looked at it. There are lots of them out there that say they're pre-moderated, but they go on once, twice, 3 times a day to take posts down. You know, that's not the same as making sure that those posts don't go up in the first place.
Well, could I just interrupt here? This is it's a really important facet of this. You know, yours is not the only mental health app for children and young people. Far from it. You know, there's all sorts out there.
There are 3,857.
Well, that's my anxiety here, is that how do we make sure that children and young people are directed to things like this rather than the 3,799 other things that actually are not up to this kind of standard? That's my question to you, I suppose. Have you got any thoughts?
Well, so we're trying doing our best. We're only little, so that's why I come to events like this to raise our profile, to help people understand, you know, to learn about us, to maybe go out and endorse us or be advocates to us. We work with an organisation called Orca.
We know Orca very well.
Okay.
We know Liz Ashall-Payne, the CEO, and
she's wonderful. Yeah, so they have rated us as one of the top 5 mental health apps that are out there. You know, you're right to be concerned. 80% of digital health products fall below quality thresholds, and I know that 3,857 figure because of Orca, and only 32% of that figure fit Orca's threshold. So we're really proud of the fact that we are one of their top rated mental health apps. And that's the other important thing to understand, is that we're not just rated on safety, it's effectiveness. So we have just recently, well, last year, the Anna Freud Institute did an independent evaluation on MeeToo, and it found statistically significant evidence that users on MeeToo feel better having been on the app. So we are actually improving mental health.
Can I just give a plug for a forthcoming Institute event, 29th of June at 1 o'clock. Orca, Liz Ashell-Payne will be interviewed with Roy Lilly and various other of our digital health and technology and social care technology representatives. And you can be certain this topic will come up because it's about managing digital risk. And if you want to listen in on that, it has absolute relevance to what Rebecca is talking about right now. Then do tune into that. As I say, I'll get the link and pop it in the chat for you all. Oh, there you go. Adam's beaten me to it. He's very rapidly off the mark.
He is multitasking.
He certainly is. There we are. Okay. Any other questions for Rebecca, I wonder?
Can I just make a little plug for us? So we are very strong within education. We're not quite so strong yet within the commissioning field, and my role as partnership manager is to try and get in front of decision makers and people who are making decisions around what provisions to provide. So if any of you have any contacts that you think might be useful for me to talk to, we've finished a pilot with Somerset NHS, and we increased the uptake of their youth. We set a target of 5%. We exceeded it to 30% of young people within Somerset ended up using the app.
I'm not surprised to hear, Rebecca, we have we have thousands of members across the UK, and we've got a very, very strong mental health special interest group who I know will be interested to hear more about this. So watch this space. We'd love to partner with you and help you to get greater traction. I'm going to ignore Adam for a moment. I'm going to go to Joe first and then come back to Adam. Joe.
Absolutely. Rebecca, just going on to that, we've probably got some contacts there to help you push that and get in front of those people that do make those decisions. So yeah, I'll touch base with you because we've got some contacts there. One question I do have, obviously your big focus is around education. We work with a lot of young people, whether that's through self-referrals or through the education system. How else can somebody utilise your service? Can we, as a mental health charity, utilise your service as well?
Yeah, so we're all about user acquisition. So there's two aspects to what we do. One is the app, and that is the foundations of what we're about. So if there's any way that we can help support you to promote the app, we can give you posters, compliment cards, things like that. If that's what you mean.
Absolutely.
Yeah, we do that for free. So, because it's in everyone's interest, to help these young people. So yeah, I'd be delighted to help with that.
Joe, why don't you pop your contact detail in the chat for Rebecca to access? Let's go to Adam and then I'll go to Fungi. Thank you.
So just two very quick ones. Has there ever been confusion around your name because of the other MeeToo movement that goes on? And secondly, we have got the people plan for social care. In the second consultation, which we're currently going through now, we are looking at the mental health and well-being of people who use care, but we don't want that to be age specific. So we're looking at social care at all age groups. So it'd be good to try and catch up after this to try and include some case studies from your app into that, and if you want to feed into it, you can do. And like I say, we launched it at the House of Lords and we're meeting with MPs, so we'll be able to try and push that a bit further for you and get you connected as well.
Oh, that would be amazing. Thank you. It's really funny, the name thing. It's an age thing. I hate to say it. That we started first, so our MeeToo was around before the other MeeToo, and it is very kids. It doesn't bother them at all. It doesn't bother them at all. You know, we did a big webinar the other day with the SBRI, and you know, everybody got quite obsessed about it, and they were coming up with different names like same here. Why don't you call yourself same here? And we're like, you know, that's really kind, but actually our research has proved that it isn't a barrier. Yeah, it's a bit annoying, and you know, but it's not a barrier to people using it. It's just one of those things.
Did you have another question, Adam, or did you just want to talk about the MeeToo? That's fine, thank you. Fun Guy, hello, lovely to have you with us. What question would you like to ask?
Let me bring myself in. Thank you for having me today, and Rebecca, thanks, an amazing presentation and the work you're doing. So I wear a lot of hats, but for this conversation, I wanted to find out from you. I think your app is absolutely fantastic, because part of the facets of one of my businesses is supporting young people 16 to 25 who we are supporting local mental health authorities to reduce the need for admissions and also improve young people's lives and reduce the risks to self-harming. So it's interesting. We've just taken on a pilot project that we are starting in the next coming weeks, where we are they've got an allocated budget to look after a set number of group of people, and we are going to see how that all is going to pan out. But I was thinking about it when you were speaking, how this can be applicable then to this demographic, being as you are talking about only up to 17. But I think
no, Rebecca's talking up to 25, Fun Guy.
Oh, is she? Okay, that's good.
Yeah. So,
okay.
Yeah.
Yeah.
And one of the
So,
no, sorry,
go
carry
ahead.
on. No, carry on. I mean, well, one of the things we see that's happened is that I think, you know, the pandemic has exacerbated a lot of you know, existing mental health issues, but it has also made it clear that there's a gap with people who leave CAMS age 18 and before they actually get entered into the adult mental health system, and there are a lot of young people who are left and they've got nowhere to go, and we see that we are filling that, you know. So although that rate I showed you, I said, you know 14 to 17 is our largest cohort, actually we are seeing that there is an increase. The 18 to 25 year olds, we're getting much more users of that age now than previously, and I think that's because, you know, as I said earlier, you know, demand is outweighing supply, and that we are managing to fill this gap. So I don't know if that correlates with what you're seeing.
Yes, so I think that is what I think it would be interesting for us to have a conversation, because we have got 5 contracts across the Midlands, and we support these young people and admit them into our services. So I'll be more than happy to have a separate conversation in terms of this area. Our biggest challenge is supporting the young people to use apps safely and to make choices which apps they must be using, because we have to work with them to help them decide, rather than maybe using Instagram, but what else can they use, you know? And it's good to have this safe
why don't you pop your
options.
contact details in the chat, Fun Guy? That would be good, and I'm sure Rebecca will contact you.
Yeah,
I will, definitely. Thank you.
I will do.
Thank you very much. And anybody else got a question, I wonder, for Rebecca? Okay, if there's no more questions, Rebecca, can we just say thank you? That was, I was very uplifting, actually. I'm really, you know, Liz knows, Liz Ashell-Payne at Orca knows how frustrated I get as chief executive of an institute looking at, you know, best practice in health and social care management, how challenging it is for people to choose the best stuff that's out there that can support them. And it's really refreshing to find something that's been put together so thoughtfully and well, and intelligently in respect of the safeguarding in particular. And I commend you. I suspect your challenge will come further down the line when you are, you know, if this turns from 60,000 into 600,000 users, how you moderate it still with your current business model, but I guess that's a challenge to overcome when you get to it, you know.
Well, yeah, we look forward to having that one. That's why we have the paid for service, so that we can make sure that we can subsidize the moderation of the app, because that is key to the success. But thank you. I'm glad you found it uplifting. I haven't got the previous lady's email. She hasn't popped it on there. I'm just worried that when we finish the chat that I can't access it.
Fungi, do you want to put that up there in the chat, I wonder? Or if indeed anybody of the other people on the call this afternoon would like to contact Rebecca, she has put her email in the chat. Do please put yours in as well if you'd like her to contact you. That would be absolutely fine. Okay.
Do you mind if I just ask a quick question? My hand raising isn't working at the minute.
Oh, that's okay. Who's
Sorry,
this?
it's Hannah Stevenson.
Hello, Hannah.
Hello. I was just wondering whether it's possible for the users to direct message each other, or whether that's moderated as well.
Yeah, so we don't. We're very lucky that working with 60,000 young people, we have an audience who we can ask, opinions, and they feed back information back to us. That has been requested. We don't want to do that because not yet anyway, and I think it's from a security point of view that I don't think we'd be able to monitor it closely enough. So no, we don't at the moment. But one of the things, so we're constantly changing the app to match their needs, so that the sliding scale of need that I showed, so the mild, moderate to everything, and also being able to exclude topics that you don't want to hear about, that came about because our users asked for that. So we are constantly, changing the app to match the needs of the young people. So yeah, we're very lucky that obviously, because we've got this audience, that we can dip in and ask them. We don't like to do it too often because they don't want to feel that they're being used. But yeah.
Well, look, and thank you for your question, Hannah. That was a really good one. Thank you very much. So did you want to follow up, Hannah? You're very welcome to.
No, that just sounds fantastic, and it's great that you can interact. That the people who are using the app have a say in what they can do, but that you can keep it safe as well. So it sounds excellent.
Jolly good. Okay, well, thank you, Rebecca. I have a funny feeling this is not the last time that we will see you or meet you. We're very grateful to you for taking a bit of time this afternoon to talk to our special interest group for children and young people. And I'm pretty sure it will lead to some good connections, and who knows, some more users for your app. I suspect that will be the case. There we are.
Well, thank you for your support. We're really grateful.
Lovely. Okay, everybody. Well, look, I'm just going to turn Rebecca off Spotlight.
Thank you. Bye.
Absolute pleasure. Thank you. I'm going to come back out of Spotlight myself, so we'll just go to gallery view. Well, look, that was interesting. What do we all think? Is that the sort of speaker and contribution that you'd like for these meetings in the future? I'm not even going to comment. I'm going to leave it up to you. What do you think? Is that the sort of thing that you'd like to have more of?
Absolutely.
Joe's nodding. Okay. Hannah's nodding.
Yeah.
John Ivor's saying yes. That's good. Okay. Adam's saying yeah. Well, look, we'll just keep lining speakers up. And if I may say, if any of you fancy speaking about what you do, 20-minute, half an hour kind of facilitated chat with me, or you might just want to present using some slides or a narrative, that's entirely up to you. But if you would like to, or really interesting people in the children and young people space who you think would be interesting for our group to hear from, do please recommend them to myself or to Jade, who's was on the call earlier on. I think she's had to go off and do something else, but we'd love to hear from you so that we can continue to expand this group and make sure that it's relevant to all of you as members of it. Okay, has anybody got any specific ideas for immediate new content that they would like us to try to secure for you? Any particular interests at all going on currently? Okay, it doesn't have to be. You're welcome to contact us directly outside of this, and we'll get it going from there. Well, okay, has anybody got anything else they would like to talk to the group about? Any challenges, any anxieties, any nervousness, any successes, this is your opportunity to tell the rest of the group about it and either seek some support or seek some praise. It's up to you if you'd like to do that now.
Sorry, John, to interrupt. I was just thinking, obviously creating these social care workshops for the IHSCM, and a lot of them always get focused on elderly or learning disabilities, home care, residential care, and we do have managers as part of the membership who do provide children's services. So if there's any thoughts around what sort of workshops children's service managers might benefit from, then please do get in touch with myself and I can try and get some workshops organised around that for our members who provide children's services as well.
We also had a really good call this morning where somebody spoke specifically about learning disabilities and making sure that we feature the services available and the service excellence in that regard as well. So we will definitely be looking to weave that into this children and young people's narrative as well for future reference. All right, well, if there's nothing further, I'll bring today's meeting to a close. I'm so pleased that so many of you came along and enjoyed it. We will be having a Children and Young People's Conference, perhaps later this year or early next year. It'll be a half-day thing, a couple of hours maybe, where we'll be looking for contributions and such like from across children and young people's service provision, be that health or social care. And do please, if you'd like to get involved in that, or you've got other people who you think would be great at presenting, do let us know and we'll build that up for me as well. Just drop me or Jade a line and we'll send you the appropriate details. All right.